Good afternoon, everyone. Welcome to this webinar entitled Improve Your Fetal Cardiac Imaging, Optimizing in Grayscale and Color Doppler, presented by Ms. Mishella Perez. The AIUM is accredited by the ACCME. This webinar is designated for 1 AMA PRA Category 1 credit. By the conclusion of this webinar, participants should be able to review basic 2D image optimization and controls, improve temporal resolution by applying the DAZE technique when evaluating the fetal heart, and receive tips on color Doppler optimization. As an ACCME accredited provider, it is the AIUM's policy to ensure that the contents and quality of this activity are balanced, independent, objective, and scientifically rigorous. All individuals who are in a position to control the content of an educational activity are required to complete a disclosure form. All disclosures are reviewed by the AIUM, and any conflicts of interest are resolved or managed prior to an activity. Ms. Mishella Perez and AIUM staff members have no disclosures. At the conclusion of the webinar, you will be able to access the CME test and evaluation located on the AIUM website. Participants who complete the post-test with a grade of 70% or higher will be awarded 1 CME credit. Credits for this webinar are approved for physicians, sonographers, and radiologic technologists. During tonight's presentation, if you have any questions for the presenter, you may type them into the question box on the right side of your screen. You will be able to submit questions throughout this webinar, but the presenter will not begin answering until the end of the presentation, at which time she will answer as many questions as possible. A recording of this webinar will be available on the AIUM website. And now we're pleased to present Ms. Mishella Perez.
Thank you, AIUM, for having me here today, or for having me present as part of your webinar series. I have no disclosures. So as a sonographer and imaging specialist, optimization plays a big role in producing quality imaging, especially when evaluating the heart. So here are just a few tips and pearls that may be helpful for you and that you can apply to your practice. So poor imaging, as we all know, leads to many errors, study inaccuracy, and eventually a big misdiagnosis. On the other hand, excellent quality imaging is developed from learning and practicing the proper techniques, which leads to everyday consistency and accuracy in your study and building confidence as a sonographer or an imaging specialist. So here are the 3 main key factors that contribute to quality imaging. First, you have your transducer selection, so just understanding the various probes utilized in fetal cardiac imaging. Fetal position optimization, an optimal approach to position in the fetus in the uterine cavity, and especially challenging maternal body habitus. And image and machine preset optimization, so just understanding your key functions and how it makes a big impact on your imaging. So in this first section, we'll just discuss about the transducer selection in Grayscale. So frequency selection is dependent on the type of ultrasound transducer you would like to use. So here are a few of the different types of transducers utilized at our units. All have different operating frequencies that you could actually see at the tip of your probe or at the base of the plug, and all have different capabilities. Here we have a C4 to 8 megahertz high frequency transducer, which entails better detail resolution. This is appropriate for your first trimesters, second trimesters, and in certain cases, even some third trimesters. Here's a clip of a 19-week fetus in which a 4 to 8 megahertz transducer is used. As you can see, the fetal heart lies in a more superficial position in the uterus. So the use of the high-frequency transducer is appropriate for this setting and allows for better detailed resolution of fetal cardiac structures. Here we have the C1 to 5 megahertz low-frequency transducer, which entails better penetration. This is appropriate for your elevated body mass index patients, late second trimesters, third trimesters, and in the setting of polyhydramnios and even rib shadowing. In this clip, we could actually see the 23-week fetus, which lies deep in the pelvis, and this is due to the increased maternal body habitus. And doesn't help that there's also an anterior placenta. So the use of a low-frequency transducer allows for deep penetration, but of course with reduced image resolution. A transvaginal probe may be used in the first trimesters or even in the late second trimesters in the event that there is a suspected fetal cardiac abnormality present, or if there is difficult imaging due to an increased maternal body habitus. So this actually allows you to increase the imaging depth and provide optimal imaging, especially for early cardiac screening. And here we could actually see a 13-week fetus being scanned. You could see a 4-chamber view and as well as a 3-vessel view in this clip. So that may be helpful at times. So now it all comes down to is choosing the best transducer. So here's a 27-week fetus with a patient BMI of 39 scanned with 2 different transducers. The C4 to 8 high-frequency transducer provides great detail resolution with a bit of shadowing as we pass through the ribs, and this is due to the reduced penetration. The C1 to 5 low-frequency transducer provides better penetration as we can see a crisper view of the heart, yet resolution is slightly decreased, giving it a slightly grainy appearance. So again, it clearly depends what you are aiming for, better resolution or better penetration. Fetal position optimization in Grayscale. So one of the many challenges that we encounter is fetal positioning, especially with rib shadowing in the way, as you can see here. Now, how can we avoid this? How can we actually improve this image? So what you could actually do is utilize the entire maternal abdomen. You want to sweep your probe high, you could even sweep it low, move over to the maternal left and right, and explore your different angles to avoid the rib shadowing. Another technique is optimizing your angle of insonation. So as we all know, the optimal approach to the heart is an apex up, spine down position. However, we know that isn't always the case. So here we have a fetus positioned on the left lateral side of the uterus. We can get a decent view of the heart by scanning between the ribs to reduce shadowing, but how can we further optimize this? So a helpful technique is you want to move your transducer to the opposite side of the uterus to get an apical insonation of the heart. And here we could actually see the heart better. So choosing an apical insonation over a lateral insonation. So again, this just comes down to a helpful tip. You want to utilize the entire maternal abdomen. Image and machine preset optimization. So just understanding your knobs and how they affect your image. So one of the factors that play a big role in 2D image optimization is temporal resolution. So temporal resolution is the ability to accurately locate moving structures at any particular instant in time. And what do fetuses do? They are constantly moving all the time, especially fast-moving structures like the heart. Now, how can we improve our temporal resolution? So when imaging the fetal heart, it is recommended that a high frame rate greater than 25 frames per second is recommended. So let's aim on doing just that, improving our frame rate. So here are a few technical settings that affect temporal resolution. We have the depth and focus, sector angle, zoom magnification, and frequency selection. So the better the temporal resolution, the higher the frame rate, the improved detail resolution. So let's go ahead and focus on improving these settings. So this is the first image you see when you start scanning. How can we improve this image? But before we move on, let's take note of the frame rate at 35 Hertz. So increasing the frame rate also improves temporal resolution. So let's go ahead and focus on doing that. Let's get rid of this unnecessary depth and make sure that your focus is at the region of interest. So this depth is actually called depth and focus. So you're coming from an image of deep imaging, more depth, worse temporal resolution, to an improved image of shallow imaging, less depth, better temporal resolution. Well, let's go ahead and just focus on the focal zone. So what if your focus is not at the region of interest? So here you actually see the focus that is at the incorrect level. You see a less sharp image of the heart. But as you adjust your focus to the appropriate level, here you could see a dramatic change in how the heart is clear compared to the first clip and most sharply imaged. So you have to remember that the area where the focus is where the beam is most narrow. This actually improves your temporal resolution and also improves detail resolution. Now, how about multiple versus single focal zones? So with a multiple focal zones, as you can see, it actually maximizes the lateral resolution, but it tremendously slows down the frame rate, which actually provides worse temporal resolution. So what you could actually do is switch to a single focal zone to increase the frame rate. And here you have better temporal resolution of 44 Hertz. So that more than doubled. So by applying the first step, the frame rate has now increased to 46 Hertz. What else can we do to improve our temporal resolution? Why don't we cone down and narrow this wide angle width? This step is called sector angle width. So you're coming from an image of wide sector angle, worse temporal resolution, to an improved image of a narrow sector angle, better temporal resolution. So now our frame rate has actually tripled to 112 Hertz, so which is great. What else can we do to increase the frame rate? Let's get rid of this extra near field space and magnify to our area of interest. This step is called zoom magnification. So you're coming from an image with no magnification to an improved image with magnification. In comparison with the two, we can clearly see which is the better image. So after applying all these steps, we can see the heart clearly, and temporal resolution is at its best with an increased frame rate of 148 Hertz, which is great. But wait, there is still more that we can do. We can actually enhance our image. So enhance, by definition, is to intensify or further improve the quality of your image. And this is all done just by doing a few adjustments to these few settings: harmonic compound spectral reduction imaging, harmonic frequency, dynamic range, or even scanning in different tones. So harmonic imaging is an advanced imaging technology in which body tissue reflects ultrasound signals at twice the scanning frequency. As you can see in this animated diagram below, the reflected harmonic wave has a lower amplitude and a higher frequency than the first fundamental wave. Because of this actually increases the axial and lateral resolution, decreases artifacts, also increases signal-to-noise ratio. And here's just an example of harmonics off and harmonics on when evaluating the three-vessel view. With harmonics off, you notice a very grainy appearance of the three-vessel view. And even just looking at this clip, it's even hard to recognize the three-vessel view as we don't see the edges so well. But with harmonics on, you could clearly see a beautiful three-vessel view and also the borders really nicely. So helpful tip, you want to scan with harmonics on. Compound imaging. So compound imaging is in which ultrasound sends signals at multiple angles, allowing you to see structures from different views, compared to traditional transducers, as we see below, that send ultrasound signals in a single line that is perpendicular to the transducer's footprint. So because of this, it actually increases image resolution, eliminates artifacts, shadows, and also increases edge detail. I have also included the manufacturer names below for those who have different units and you're able to look for the specific application. So here's just an example of compound imaging off and compound imaging on. With compound imaging off, it's almost, you can't really recognize the interventricular septum, but with turning on compound imaging on, here we could see the interventricular septum clear in comparison to compound imaging off. So helpful tip, you want to scan with compound imaging on. Speckle reduction imaging. So this eliminates speckle, weak signals and strong signals are enhanced and brightened. What this does, it actually provides smoother, cleaner image. So here's an example of speckle reduction imaging off and on, and we are looking at the left ventricular outflow tract. With SRI off, it's almost like we see some striations along the interventricular septum that makes you think like, well, is there a suspected ventricular septal defect in that area? But when you turn SRI on, you could see the smooth, nice walls of the interventricular septum. So helpful tip, you want to scan with speckle reduction imaging on when looking at the heart. Dynamic range. So dynamic range allows you to tell the ultrasound machine how you want the echo intensity displayed as shades of gray. So a wide dynamic range introduces more shades of gray into an image, whereas a narrow dynamic range results in a more black and white. So when evaluating the fetal heart, a narrow dynamic range, less grays, provides better image display as low-level noise or artifacts are eliminated. So here we have a right ventricular outflow tract in two different dynamic range settings. In a dynamic range of 10, we can appreciate the heart structures better, sharp and defined with less gray. So therefore, cardiac structures are better visualized with increased contrast. Harmonic frequency. So harmonic frequency has a range of frequencies, high, mid, and low, and adjusting the frequency allows you to increase resolution at the expense of penetration. So we have two clips. This is the same patient just demonstrating the use of a high harmonic frequency. You could see the heart, although and also has enhanced resolution, although as you could see there is decreased frame rate of 39 Hertz. And here we have the low harmonic frequency being utilized. This actually decreases the enhanced resolution, yet we do have better penetration of the heart and an increased frame rate of 65 Hertz, which is ideal for fetal cardiac screening. So again, it just depends what you're looking for, detail resolution versus penetration. Scanning in different tones. So manufacturers have made available more color maps. Perhaps this may actually improve visualization or pattern recognition, as the human eye is able to distinguish image details in colored rather than on grayscale. So what I've noticed is a lot of people, or a lot of cardiologists, they usually like to look at the heart in sepia to pick up just the subtle differences in echo texture that are difficult to see in grayscale. So why don't you go ahead and give it a try and you be the judge. So just going back to our 2D image optimization steps, which will be helpful. You have the depth and focus, sector angle width, zoom magnification, and enhance. I call this the DAZE technique. So apply your DAZE technique when looking at your fetal cardiac structures and provide the best optimal image that you can in 2D imaging. So now moving on to the challenges that we encounter in grayscale. So morbid obesity accounts for 1/3 of the population and more than half of pregnant women in the United States. Here's a very interesting article by LaCourcier et al. Back in 2005, just showing the maternal obesity trends. So there was a total of 507,000 live births, and there has been shown of an overweight and obesity by 40% in a decade. So it's very important when scanning the obese patient, we know how to apply these techniques that will be helpful for us. So the main difficulty arises when the size of the extra tissue increases the distance between the transducer and fetal anatomy, therefore degrading resolution. So here are just a few helpful techniques that reduce the distance and improve 2D optimization. One you could do is actually scan underneath the excess tissue. You want to request extra assistance, of course, to avoid injury. You could ask the patient to lift up the extra tissue, or even an extra person to assist. Remember, you have to maximize your optimization skills and apply the DAZE technique. And this, you could actually see the heart better as there is decreased imaging depth. So another technique that helps but requires more effort is actually scanning above the extra tissue. So this may result in injury due to the exerted pressure that you're applying on top, because you do have that extra depth to penetrate. Another helpful tip is to scan when the patient bladder is full, as it raises the fundus towards the cephalad level, and this you have a decreased imaging depth. Another option is you could actually scan through the umbilicus. That would decrease the distance, but most of the time shadowing may occur. So a commonly used technique is to scan with the patient in Sims position. So with Sims position, this allows the extra tissue to fall to the left side, therefore decreasing the distance between the probe and the fetal anatomy. Again, remember to maximize your optimization skills to get the best possible image. So it's very, important to stress how patient positioning can actually reflect on how our images would come out. So here is a 23-week fetus with a BMI of 55. This is very obviously difficult scan. We utilize a low-frequency transducer. Here we have the patient on her back, and you can see an increased imaging depth of 6.4 centimeters. But when we have the patient turn over towards her left-hand side in Sims position, now we have a decreased imaging depth of 2.7 centimeters. And here you could clearly tell the difference, how beautiful the heart looks in comparison to the first clip. So it's very important to try utilizing these techniques, especially when scanning the obese patient, to produce the best optimal images. So here are a few helpful tips. Keep in mind to choose the appropriate transducer, switching to a low frequency transducer. Also, you want to maximize your optimization, utilize the DAZE technique. Also, decrease imaging depth as much as possible, so utilizing the different positional techniques for the patient, or you can actually bring the patient back. So now we're moving on to color Doppler and how we are able to apply these settings correctly. So the question that I get asked often when training other sonographers at different sites is, why color Doppler? What is the importance of color Doppler? Why is it needed? Well, as we all know, color Doppler is an integral component of fetal cardiac screening in every fetus, especially when there is a suspected abnormality. For one is, it does demonstrate the presence of blood flow, so being able to determine if perfusion across the valve, whether the valve's either atretic or dysplastic. Also demonstrates the direction of blood flow, whether blood flow is antegrade or retrograde going through the aortic arch or through the valves. Also detection of unexpected blood flow events, such as shunting across a ventricular septal defect, or if there's laminar or turbulent flow going through the valves or the arches. It's also able to demonstrate small vessels, such as the pulmonary veins, ductus arteriosus, or even abnormal small vessels, such as collaterals or even dilated azygous vein. Also, it optimizes the placement of sample volume for spectral Doppler evaluation in the setting of stenosis or even regurgitations. And lastly, I felt it's very helpful to demonstrate the normal atrioventricular and ventricular-lateral connections in cases Grayscale is unable to conclude. So this also applies to for your difficult scanning patients, such as an elevated body mass index patient. So color Doppler examination of the fetal heart is enhanced when these proper settings are applied. So let's review these applications to avoid improper use of these settings. The color box, when activated, slows the frame rate to a significant degree. So here's an example of a large color box. And as you can tell, this clip has a decreased frame rate, and the frame rate is 12 Hertz. Now, what can we do to actually improve this image? You can choose the smallest color box possible to maintain a high frame rate, therefore improving the temporal resolution. And just by doing that, here we have the frame rate up to 21 Hertz. So keep in mind to have a small color box, but enough to cover your area of interest when applying color Doppler. Angle of insonation. So you want to insonate the heart in an angle parallel to the direction of blood flow. So here we have the 4-chamber view in color Doppler that is best visualized from an apical view or a basal view in order to demonstrate ventricular filling. So in these orientations, the course of blood flow is nearly parallel to the angle of insonation. So it's very important where you want to be parallel with the angle of insonation in order to interrogate the valves or to make sure there's no evidence of a laminar or turbulent flow. So the same goes for when looking at the LVOT. Color Doppler is best visualized from an apical or transverse view in order to align the flow within the aorta in a near parallel course with the angle of insonation. Velocity scale pulse repetition frequency. So this determines the range of mean of velocities in the region of interest. So for color Doppler interrogation of the AV valves, semilunar valves, and great vessels, a high velocity range of at least greater than 50 centimeters per second is appropriate. And a low velocity range of less than 30 centimeters per second is suitable for evaluating the pulmonary veins and the bicable view, which is the SVC and the IVC, given their low flow velocity, and evaluating the atrial and ventricular septum to detect wall defects. So this clip shows an improper use of a low PRF of 1.8 kilohertz when evaluating the atrial ventricular valves. This results in aliasing and turbulences within the chambers. So in order to actually correct this, you want to set your scale to high, so that is with a PRF of 6.0 kilohertz, which is actually appropriate for interrogating the atrial ventricular valves. So this clip is an attempt to view the pulmonary veins. So what is wrong here? We could actually see the pulmonary veins in 2D, but color Doppler isn't filling in. So this is due to actually the high PRF of 6.0 kilohertz, which is incorrect. So in order to visualize the pulmonary veins, you have to set your scale to low, and here we have selected 2.4 kilohertz, which is the appropriate setting. Wall motion filter eliminates signals from wall motion and low velocities. So when interrogating the flow across the valves, you want to make sure you have all the proper settings. So in this clip, you can easily suspect a possible ventricular septal defect, especially with your PRF set appropriately, which is at 6.0 kilohertz. So in this case, a low wall motion filter was selected, which is incorrect. So when evaluating the atrioventricular valves, you want to use a high wall motion filter to avoid these errors. And here you can clearly see the difference between the two. Same with the pulmonary veins. Here we have our PRF scale set to low at 1.8 kilohertz. Yet we are not seeing the pulmonary veins filling in. This is due to an incorrect wall motion filter set to high. So utilizing a mid to low wall motion filter setting is actually appropriate to evaluating the pulmonary veins. And here you can see the pulmonary veins draining in nicely into the left atrium. Color gain, the amount of color exhibited. So color gain should be initially set on low and gradually increased until color is optimized. So here's an example of color gain set to high. And this results actually in color overlap of the septum, mimicking the presence of an atrioventricular septal defect. So this obviously can lead to many errors and is incorrect. So reducing the color gain to the appropriate low settings shows the normal flow pattern without the color overlap is correct. So how about balance or priority? So balance allows you to display how much grayscale information you would like to see. Grayscale versus color. So assessing the pulmonary veins can get very messy, especially with high definition flow settings. So when adjusting your balance, you have the ability to control what you would like to see more of. So with a high balance, you actually tell the system to display more color, as you could see there. But with a low balance, you tell the system to display more grayscale. So this is helpful for displaying more wall definition and evaluating the pulmonary veins without all the excess blooming effect that we see with the increased balance. So another excellent technique with color Doppler and with tips on attenuation in the obese patient. So color Doppler, as we all know, the signals returning to the transducer are attenuated at the same rate as grayscale echoes. So increased imaging depth is actually equal to the increased attenuation of Doppler signal. Current transducer technology allows the operator to scan at a central frequency and Doppler at a lower frequency of its bandwidth. So when utilizing color Doppler on an obese patient, you notice that color flow isn't filling in. So this is due to the attenuation of Doppler signal by the increased imaging depth. So in order to strengthen that signal, you can actually go to your color submenu and lower your color flow frequency. So here's an example. So in this case, this is a query right heart disproportion. This is a 23-week gestation with a patient BMI of 50. So this is actually a very difficult scan. A low-frequency probe was used for 2D imaging, and the sonographer lowered the scale to try to fill the heart in with color. And as you can see, it's as low to 30 centimeters per second, but only produced aliasing. So as we were looking at the settings, we noticed that the color flow frequency was set to high. And we made a few adjustments. So here we could actually see that the heart is now filling in with color, and we could see a severe tricuspid regurgitation. So what were the steps that were done? So color flow frequency was adjusted to low, and that's by going in a color submenu. And the velocity scale was actually increased to 88 centimeters per second to define the color of the tricuspid regurgitation. And here just demonstrates severe TR. So here is a before image with color flow frequency set to high, which is the initial image, and then making these manual adjustments on your color flow submenu, it was set to low. And here you could display and confirm the diagnosis of severe tricuspid regurg. So that's an excellent tip to think about when scanning your obese patients with color Doppler. So our last section is high definition Doppler. When is it useful? So before we begin discussing more about high definition Doppler and its uses, let's differentiate between the three Doppler techniques. So color Doppler, as we all know, is angle dependent on the angle of inclination of the ultrasound beam with the direction of flow. This can be a major limitation of color Doppler in comparison with the other two, especially for structures that are at an increased angle to direction of flow. Color Doppler also provides directional information and velocity information, and which provides qualitative and semi-quantitative hemodynamic information. And the disadvantage is unable to detect low flow sensitivity. Power Doppler is angle independent, and this is being able to detect right angles to the beam, does not provide directional information, as we all know, and velocity information, and has the ability to have high detection for low flow sensitivity. High definition Doppler, on the other hand, is also angle independent, just like power Doppler, but also provides directional information, velocity information, and has the ability to detect low flow sensitivity. So when actually comparing all three, high definition Doppler has been shown to be superior to power and conventional color Doppler in most aspects. So what are we able to use high definition Doppler for? Or when is it useful? So high definition Doppler is useful when evaluating the pulmonary veins. And this is due to its low flow sensitivity and detection of small vessels. You want to keep in mind to keep your color blocks small in order to maintain the high frame rate, and you want to set your PRF to low and a mid to low wall motion filter, which is appropriate for the pulmonary veins. Utilizing high definition Doppler is also helpful for evaluating the bicaval view. So its low flow sensitivity and enhanced definition provides clarity of the margin of the vessels, and it's also to determine or depict any size discrepancies between the IVC and the SVC. You want to keep in mind again small color box to increase the frame rate and to avoid to lessen the blooming effect, and to also minimize flash artifacts. You want to set your PRF to low and wall motion filter low, mid to low as well. So HD Doppler is also most especially useful when evaluating the ventricular septum for small wall defects. So high definition's advantage is less blooming artifacts compared to color, and also enhanced sensitivity to even the smallest of Doppler shifts. So this we're able to detect even the tiniest ventricular septal defects across the wall. You want to make sure that when evaluating the septum, you want to be perpendicular when evaluating the wall, and then also panning throughout the wall. You have to keep in mind that the septum does have depth, so you want to pan thoroughly. You want to set your PRF to low to be able to apply the correct settings when looking at the interventricular septum. High definition Doppler is most especially helpful when evaluating the aortic arch. So its sensitivity to the small vessels, flow detection, irrespective of angle of insonation, and better axial resolution allows us to evaluate the, as you can see, the brachiocephalic vessels and aortic wall caliber that we could see here very nicely for any presence of abnormalities. So in addition to high definition Doppler, color Doppler is also helpful in detecting the presence of aliasing or turbulence in the aortic arch, since high definition Doppler does not display aliasing very well compared to color Doppler. And I'll just show you an example on our next slide. So these are two clips just demonstrating mitral regurgitation. Color Doppler displaying aliasing while high definition does not display it as well compared to color. So the reason for this is that high definition Doppler has shorter pulses compared to conventional color Doppler. Shorter pulses allow for a higher pulse repetition frequency, therefore raising the Nyquist limit and improving the aliasing artifact. So I found this very, very helpful as, you know, I look at structures both with high definition Doppler and also with color, especially with the aortic arch, and how color is able to identify aliasing in comparison to HD Doppler. And this will help in aiding the diagnosis as well. So key points, you want to understand your key function and controls and how they can affect your image. Utilize the entire maternal abdomen when optimizing fetal position. Apply the DAZE technique, depth, angle, zoom, enhance. And optimizing resolution and utilizing scanning techniques will minimize false positives and false negatives, therefore improving detection. Thank you very much.
Are there any questions? Okay, well, thank you very much to our presenter, and on behalf of the AIUM, our thanks to all of you who participated in this webinar. Please remember to complete the post-test and the activity evaluation. We hope you enjoyed this presentation and will join us again for future webinars. So long, everyone.